All right, folks, welcome to the Fitness Tips for 55 Plus podcast. My name is Dr. Dustin Jones.
I'm Dr. Jeff Musgrave, Doctor of Physical Therapy.
So this is our first episode where we're going to be covering lots of different topics from the Stronger Life community. So for reference, we have an associated Facebook group with this podcast. It's called Fitness Tips for 55 Plus. You can search that. You'll see, the logo. You'll see it's brought to you by Stronger Life, and in that are Stronger Life members, but then also folks from all over the country, the world, that just want to make sure they're doing the right thing or want support. They want to have a resource in the community for as they're going north of 55 and wanting to pursue different goals related to fitness and health. And so we want this to be a service to y'all. And so in that Facebook group is where we get a lot of these questions. Before we get into it, Jeff, this is kind of a special time of year because it is Stronger Life's 4th birthday.
Yeah.
Could you give folks kind of the quick and dirty of like what is Stronger Life and kind of our journey, up to this point?
Yeah, absolutely. So, Dustin, you approached me about, a problem that we both saw as physical therapists is people would go to physical therapy and insurance doesn't care once you get to baseline. Pain's manageable, you can do the basics, and then you get kicked out. But the reality is that base level is where you were right before you got injured. And where the magic happens is fitness. Mm-hmm. We learned that, if you want to isolate yourself from risk, chronic disease, risk of coming back again, we really have to bridge the gap to some level of fitness and building that physical reserve to isolate ourselves and reduce our risk of injury. And when you came to me with this idea of like, hey, we need a place for people after discharge from physical therapy or people that know what people 55 plus need to be able to age well and to reduce their injury risk. And there's nowhere serving them. You can throw a rock and hit a placement for someone in their 20s or 30s, but someone that understands an aging body that has intentionally spent time learning about it, guiding others, you can't find it anywhere. So when you brought that to me, I was like, dude, this is great. So we started in a local gym, CrossFit Maximus, had a great time. Started with just a handful of people doing classes when they weren't operating. And then that has slowly grown into our own space here in Lexington, where we got to dial in the equipment, the exact movements, the experience that we want, and really try to serve people really well. Mm-hmm. And the community is just such a fun piece of this, seeing people 55 plus that are all going through different injuries or different struggles all come together and support each other, kind of show up and run their own race is just such a beautiful thing. It's just been such an honor to be on this journey with you. So I'll forever be grateful for you saying, hey,
me too, man. This
could go nowhere or this could be huge. And I'm grateful to be along for the ride.
It's, and for us too, I would say it's kind of a selfish endeavor in the sense of like, this is what we want, especially when we get to that phase of life, north of 55. And so it's really taken off to be something that it was hard for us to envision what it is now, I think, at the time, in terms of the community and just what it looks like. And it makes me excited to the future. And then for us, to have something, when we get to that point as well. So it's kind of a selfish endeavor too. So
well, selfish because these are the people we want to serve too. Yeah. These are our favorite people.
For sure. So that's kind of the backstory. So let's get into maybe one of the most common questions that we get. So just for reference, we have a lot of folks that will join the Strong Life community. And some of y'all watching or listening to this, it may be the same situation as well, where all right, I need to get stronger. I need to start exercising. I need to take up this routine. And then you start doing the thing and you realize, I'm a little sore. This is kind of tough. The first few workouts, the day after, for some folks, it's a couple of days after, they have, just a little bit of soreness. And that, if that's new to someone, that can be tough to navigate. So Kristen Fowler, longtime Strong Life member. What's up, Kristen? Thank you for submitting this question. She says, so when you are hurting the day after a workout, how do you know if it's time to rest or time to move it some more? how do we know what is good pain and what is bad pain? And that last part, how do we know what is good pain and what is bad pain? That is a very important question to understand, because when people start, if they have quote unquote pain or soreness, it can be rather discouraging. But once you get past that hurdle, the sky's really the limit. So how would you first respond to that when you say, how do we know, when Kristen says, how do we know what is good pain and what is bad pain after that first workout?
Yeah, absolutely. So there is going to be, if you've not been active, you're doing new movements or you're doing them through a new range of motion, it's really common to get what people will call delayed onset muscle soreness. So that can happen anywhere from 24 to 72 hours after a workout. And that's the body's normal response to challenging itself. So there's some level of discomfort that's expected. Some of the hallmarks, as you're well aware, we both experienced lots of delayed onset muscle soreness in our exercise career.
Every week.
Yeah, it's a normal thing. Some of the earmarks of that is some light activity usually makes it better. When you first roll out of bed, you're like, uh-oh, what have I done? But as you're moving, it gets better and better. And I feel like one of the earmarks is if you're coming to the gym or you're pursuing fitness and you have some type of active injury where it's like, ooh, I've got this back injury, I've got some sciatica, and when I do the wrong thing, if I don't move well, I don't warm up good, then I get, numbness and tingling down my leg and exacerbating a symptom of a known, injury. That's not a normal response to exercise. Versus in the area of the muscles I worked, I've got some diffuse kind of all over the muscle discomfort. And sometimes it can be pretty significant if you really challenged yourself, because you're not going to know at the time. You find out 24 to 72 hours later.
Yeah.
But that's a big earmark for me is, does some light movement make it better? Is it in the area of the muscles you just worked? Or is it more of like a known injury getting worse in an area, a familiar, like, ooh, I got this shoulder thing I've had for years and it's sharp and painful and like doesn't get better with movement. Those are some big earmarks for me. How about for you?
Yeah, I think those are all spot on. I think the diffuse part is what I'll often refer to if it's just like the dull, broad discomfort in an area that I know I worked the other day or the day prior. And for me, I'm a 24-hour guy, but like my wife's a 48 to 72 hour.
Yeah, so I'm a 48-hour guy.
Yeah, we'll do the same workout. I'm struggling the next day. She's not struggling until 2 days after. But I think also for a lot of folks that, when you have that soreness, usually it's symmetrical in the sense of you are sore on the right and left shoulders and thighs, for example, versus like one is really talking a lot more than the other. Particularly here at Stronger Life, because so much of what we do is what we call functional exercise. So it's total body. We're using, both arms, both legs. And if we do get sore, it's going to be kind of both sides. So those are the big things for me. And the movement piece is huge. And it's always, even though I know better, I'll go in if I'm really sore and I'm going in to move. Like it's still like, man, I'm super stiff. This is rough. You're like, I don't know about this. And then sure enough, 5 minutes later, you kind of forget about the soreness. So I think what's really cool too is the explanation of DOMS, even since we've come out of school. So we went to physical therapy school together, UK, in 2008 to 2011. And in that period of time, the explanation behind DOMS has just changed dramatically. And it's continuing to evolve. So like when we went to school, it was mainly about a chemical reaction of lactic acid buildup, and that was an irritant to our muscles, and it caused that diffuse soreness. And there's like a little bit of truth to that. Then they dove a little deeper, and then they started to talk about, well, it's we're micro tearing the muscle, like we're causing these micro damages, and we're getting this inflammatory response. Which is that definitely does happen to some extent. And now it's even evolving a little bit more to, we may see some micro tears, if you will, and we get that inflammatory response. But the discomfort is mainly from where that inflammatory response is coming in. We're getting a little bit more fluid and there's more pressure in that area. And that is really a big explanation for why the movement helps, because when we move, our muscles are pumping, it's moving fluid, and it can often reduce some of that pressure. That may be helpful to think about when you get out and you're sore and you're like, oh, this is really uncomfortable, but if I move, it'll make it better.
And that makes sense. And that doesn't support a muscle tear. Like, why would a muscle tear feel better with more movement?
That's a good point.
But when you think about the cardiovascular system, the only way to get fluid or inflammatory like mediators in or out is the cardiovascular system. So getting some blood pumping, now that makes sense with getting those inflammatory agents out. That's our superhighway to move them out, get nutrients in. So that actually makes sense with what we see after. But micro tears and lactic acid doesn't really.
Yeah, and then maybe in 5 years we'll look back at this and be like, man, I can't believe
what were we thinking?
Which is probably gonna happen. So I think this conversation. So I think a lot of folks will grasp. Okay, I have good pain. I'm sore. I will move. And so what we say at Stronger Life is, all right, you're just starting. For example, you get sore. We want you to come back the next day, even if you have that soreness, because we'll be able to modify. And we really hang our hat on the ability to modify activities so people can continue to move. But the other side of the thing is that we need to be clear on, if we have a bad pain, we're not saying to stop moving with bad pain, right?
Correct.
So this is something that's really important as a Stronger Life member, but then as an exerciser as well. And this is going to happen to a lot of folks, right? Like, life happens, we get a cranky shoulder, a cranky knee. The last thing we want to do is to stop moving, which doesn't make a lot of sense, right? It's kind of counterintuitive. So how?
Yeah, we should just rest, right?
Yeah,
rest until it feels better.
Exactly.
3 months on the couch.
That's the answer, right? And then I'll be able to go back to do exactly what I wanted to do. But it doesn't work like that. So let's say we have the bad pain. So like as a coach, how do you get folks to move if they have the quote unquote bad pain?
Yeah, that's great. And this is part of our training for our coaches too, is learning how to modify around that. Because sometimes it's only pain through part of the range of motion. Like, say it's a shoulder and it's like going overhead with weight may be off limits, but maybe without weight, it's not painful at all. Or maybe we can't go overhead, maybe overhead's off limits, but all of our muscles that help support pressing from this angle are totally fine. So we can swap those movements out. We can reduce the weight. We can change that direction a little bit. The other thing that I think sets us apart too is we're not doing the same focus area back to back.
Yeah.
So we know, because of the way the workouts are put together, you're going to get the opportunity to use your upper body, lower body, and your core and work your balance, but it's going to be in a different way than you did the day before. But as you said, in that instance of pain, reducing the weight, reducing the range of motion, or finding a similar movement through different angles may be totally fine. And a little, some very mild discomfort may be okay if it's not ramping up and getting worse. So sometimes we'll use a pain scale, 0 being none, 10 being emergency room type pain. A general rule of thumb for most people in pain is a very individual experience, but usually around that 3 out of 10, 4 out of 10, we're getting a little dicey, but anything over a 4 out of 10, we need to change something.
Yeah.
But experiencing, I can feel it, may not be a bad thing if it's not getting worse.
Yeah.
Because kind of what I think you were alluding to is those joints, to maintain their strength, their integrity, and the muscles, we have to keep moving. Because those factors that help us build, if we stop everything, then we start to lose integrity of our muscles and our joints. It's kind of like a classic car that's left in the shop. No one gets it out and drives it. The thing will rust out. It'll break down, but if you're out driving it every day, it actually is gonna age much better and work much better in the long run.
Yeah, and that's a good point. And sometimes like that, moving the bad pain helps the bad pain. Like you'll maintain your fitness, but a lot of times that knee or that shoulder will get better when you are able to get that kind of non-threatening movement. And that is another area, I think, from when we went through school, like that's completely changed.
Yeah.
You know, like how people recover from surgery, how we, you know, rehab injuries. Like it used to be, let's rest, protect this area, and then we will start to challenge it after that, you know, period of time. And now the thought is, okay, we need to get that area moving as much as we can tolerate, but also maintain fitness and strength in other areas of your body, so your recovery process is a lot quicker. And we'll see that here, right? Like I think about all the folks that they may know they are having a knee replacement, right? Like we've got a lot of folks like they're on the books to get a knee replacement, but they come to get as fit and strong as possible. And their recovery from these surgeries is insane because they're so fit, they know how to work around pain, so they don't lose a lot of that fitness. And then the recovery afterwards is typically a lot quicker for those folks. So there's very few times that we will tell you as Strong Life coaches to stop moving, to stop exercising.
Yeah.
Very few situations where we're going to say, don't come to the gym anymore.
Yeah.
We've said it for sure, but I could count on one hand probably in 4 years.
Yeah, there are very few injuries that are actually going to benefit from that type of rest. It's kind of like on a micro level, on a short-term level, thinking about how movement helps those inflammatory processes. A lot of those same processes are at play with chronic injuries.
Yeah.
So you think about, you shut down getting good nutrients and getting waste products away from the injured joint when you stop exercising. So it's like, on the micro level for soreness, it's good. But on the macro level or on the long-term level for a chronic injury, the less you move, the less your body can manage that injury and help it actually heal and recover. So it's the same thing, just across a different timeline, really.
Yeah, yeah. And I think what's important too for a lot of listeners or viewers, if you are not a Stronger Life member, we encourage you to just do your due diligence. If you join a program, work with a coach, a physical therapist, there's some amazing facilities, amazing clinicians out, you know, in the wild for sure. But some programs will be able to accommodate for that discomfort and pain, but a lot will not be able to in terms of how they have their system. So just be very mindful. Can they accommodate? Can they modify? If it's a group-based activity, could they give you different options so you can continue to move? Because not every fitness program is going to have that capacity. So do your due diligence. You can ask us too if we have any recommendations.
Yeah. We've got a big network of people across the country.
Yeah. So we can definitely help there. But I think that's a good place to kind of end that discussion, because it's a big one, it's a common one, but there's good pain and bad pain. Movement seems to almost always be the answer.
Movement is medicine.
It is. So if you all have any follow-up questions or anything to your specific situation, feel free to submit that question in our Facebook group, Fitness Tips for 55 Plus, and we can hit on this a little bit more. But this is what these episodes are going to look like. We're just going to take one of your all's questions and jam on it, share our perspective, what the evidence is saying, and then what we're seeing, here at Stronger Life. But yeah, I think it's a pretty solid first episode.
Yeah.
All right.
Nice work.
Awesome.